Hi, my name is Dr. Danielle Lane, and I'm the medical director at Lane Fertility Institute. Many of you have seen me on my TikTok videos and on many of my Instagram reels, but today I'd like to talk to you about using donor eggs. And I think this is an important topic because there's been a huge increase in the use of egg donation in the United States over the past years, so much so that there are now organizations that are egg banks that do nothing except sell frozen eggs to patients. And so I'd like to talk a little bit about the different ways in which you can think about using an egg donor and some of the things you should consider when making a decision about what type of donor to use. First of all, I think it's important to know that we both have a donor egg agency and we are a production clinic for an egg bank. We do have our own egg bank and we use those eggs with some of our patients internally. But we also match directed donors with intended parents that may or may not be our patients. And we also produce eggs for a large donor egg bank. And so as a consequence, we are working with egg donors at a fairly high volume, anywhere from 8 to 13 egg donors a month. What this means to you as a patient is that our embryology lab has a tremendous amount of experience with egg donors and with retrieving eggs, isolating eggs, cleaning them, freezing them, and then thawing them for use. That's an important thing to consider when you're making a decision about both what type of eggs to use and where to do your cycle. Because unlike embryos that we've been working with as an industry for many, many years, eggs are actually newer to our industry and are much more fragile than even a day 5 blastocyst embryo. And so what this means is that if a clinic or an embryology lab doesn't do a lot of work with frozen eggs, even the best frozen eggs may be difficult to thaw properly or fertilize properly, and outcomes may just not look the way they should based on purely just experience. I've seen some questions that people have asked about how many eggs to buy, and this really depends on a couple of things. The factors include what your family plan looks like, in other words, how many children do you want to have, but also how much experience your lab has. And so in order to answer the first part of that question, you need to think about the fact that historically, the American Society of Reproductive Medicine stated that they expected to obtain 1 live birth from 6 donor eggs. Now, at the time when we made that, we were talking about women who were freezing eggs for their own future use. Generally, we were talking about women under the age of 35. But as outcomes have continued to increase in number, now we really want to see many, many, many more eggs for someone to safely complete their family than just 6 eggs per 1 live birth. That said, when we're using donor eggs, what we typically find in our own lab is that assuming that a donor meets criteria for being an egg donor, so they're under the age of 30 for us, their BMI criteria are appropriate, their antral follicle count is high, their anti-Müllerian hormone levels are high. In that case, what we find is that if we freeze eggs, the thaw rate of eggs that survive is 96%. So we expect the majority of the eggs that we freeze and then thaw to survive that process. Now, it's important to note that most of the eggs that we're using, almost 100%, are eggs that we have frozen. So we're very familiar with the freeze protocol and also then with the thaw protocol. And we do it over and over and over again. In addition, the fertilization rate of those thawed eggs in our hands are 89%. That's really the same as what we would see in a fresh egg. That's certainly not the case in every lab. It's certainly not the case in, with every freeze and thaw protocol. But with the protocols that we use, both the ones we use for the production clinic the egg bank that we produce for, and the protocol that we use for our own internal donors that we're not sending to that egg bank, those protocols give us an 89% fertilization rate. Finally, the blastocyst rate per fertilized embryo from frozen eggs, 65.6%. And then the blastocyst rate per lot of eggs, which is usually somewhere between 6, but can be as low as 5 and as high as 9, is about 58% per lot. Okay, so it's important to really understand those numbers. What that should mean to you as an intended parent is that not all of the eggs that you purchase will survive. Not all of them will fertilize, not all of them will become blastocysts, and then if you test them, we know that probably about 2/3 of day 5 blastocysts will actually result in a euploid embryo. Sometimes you can see numbers higher than that, but often you can see numbers slightly lower than that as well. So I think that when you're thinking about deciding to use donor eggs, it's important, especially if they're frozen donor eggs, to talk to your lab about what their thaw survival rates are, fertilization rates with frozen eggs are, blastocyst rates are, so that you can have a reasonable expectation of how many normal embryos you can try and expect or anticipate based on the number of eggs that you buy. In addition, if you know that you want to have multiple children, gender selection for family balancing, or if you're trying to avoid a genetic abnormality that's in your partner, perhaps, or maybe in the donor even, then you may choose to purchase more eggs to try and accommodate that. So for people that really just want a singleton, we generally recommend somewhere between 6 and 8 eggs, particularly if they have some other factor like endometriosis or fibroids that are not submucosal, don't need to be removed, but might be a factor. Those are times where we'd want to have them order a few more eggs. On the other hand, if you have somebody who knows that they are particularly interested in having a male or particularly interested in having a female, then we recommend that they order 12 eggs so that we have a better shot of having a euploid embryo, a genetically normal embryo that meets the criteria that they're looking for. If we have a same-sex male couple where both partners wish to have their sperm be represented in the embryos that are being created, then again we recommend a minimum of 12 eggs so that each partner can provide sperm for 6 of those eggs. The last thing I'd like to speak about is whether or not you should have frozen eggs sent out from a bank, or whether you should have embryos made at the location that the eggs were frozen and then have embryos shipped out from the bank. The difference goes back to my original comments around the fact that clinics that don't freeze an egg may not have the same outcomes when thawing those eggs as the clinics that actually froze the eggs in the first place. And so I'm seeing a trend of more and more clinics, in fact, encouraging their patients to consider having the embryos made at the same place where they find the frozen eggs that they're interested in, to try and increase the likelihood that the number and quality of the resulting embryos will be as good as possible. And so you might consider, instead of just having eggs sent to your clinic, having sperm from your partner produced or sent to the location that the eggs are at, and then having embryos made at that location and having the embryos shipped to your clinic. So that's just something to consider. And again, the goal of that is that we know that there are various different protocols for freezing and thawing. There are various nuances to all of those protocols. And if you're in a position to have the same clinic both freeze and thaw the eggs, there is a possibility that you will have more embryos available as well as better quality embryos on the back end. I hope that this series of answers has been helpful for those of you that are considering using donor eggs. Again, there are a lot of different ways to use donor eggs, and this should address some of the questions that might be circling as you decide what the best path is for you. And I'd like to speak briefly on the conversation of shared donor cycles. So a lot of times patients are interested in using donor eggs or working with a directed donor, i.e. a donor that is donating all of their eggs to 1 or 2 patients, but they may not be in the financial position to work with donors in that way. And so one of the things that comes up is the opportunity to have multiple couples work with a single egg donor so that the costs can be shared amongst the patients or couples that are in fact going to receive some of the eggs. So while that can be beneficial, there are a couple of downsides to that, and the biggest one is the waiting game. So the idea that multiple couples are going to want the same donor or multiple single patients are going to want the same donor is not necessarily realistic. And so some couples can find themselves, or patients can find themselves, waiting for a pretty long time while a second patient or patients come available as being interested in the same donor. So one of the things that we have done in our clinic is that when we stimulate an egg donor, we actually are willing to match cohorts, smaller numbers of eggs from that donor, either fresh or later down the road frozen, with individuals without waiting for another patient or patients to want eggs from the same donor. And this really allows folks that are interested in doing a shared cycle to cycle almost immediately. I mean, obviously we need to wait for the donor to start a cycle and wait for her to, finish her stimulations, but instead of waiting months on end, you might be waiting a few weeks for the donor to begin her cycle. So I think that's something to consider and ask your clinic or your agency if that's a possibility, because in addition to saving you money, it saves you time.